everyone, it's Pete here from the Pain Toolkit. Hey, look, we're back again doing another Pain Toolkit Academy Q&A. And Dave's back. He's had that summer cold, but he's still marching through there. Good afternoon to you, Dave.
Good afternoon, Pete. No, I was trying to cough offline so that you didn't deafen everybody.
Yeah, and listen, we've got a special guest with us today. And our reason why she's special because we're good buddies. Linda Crawford from over there in Denver in the US. Good afternoon. Well, good morning to you, Linda.
Hi, thanks, Pete. Yes, good morning and good afternoon to you.
Let me just tell the listeners and viewers how I know you, how you come to be a good friend. Myself and Linda, we met at a IAPS Congress back in 2018 in Boston in the US, and uh, it was to me it was a special conference, like because a lot of people there met, and we've all remained good buddies since. But hey, listen, Linda, do you want to just tell people just very briefly what do you do and etc. Just 1 minute if you can.
Sure. Oh, 1 minute. Okay. So I've been an occupational therapist for over 35 years. I practiced in neuro rehab at first, mostly working with people with strokes and brain injury, but then went into pain specialization after I had my own chronic pain experience, my personal experience, and going through treatments that didn't work and researching and studying. And when I came back to practice, I opened a private practice, working with people very individualistically, and got involved in pain world, I guess you would say, where I met Pete. And now I'm more educating, mentoring students and practitioners um, in giving supported self-management pain care that people
Sure.
really need.
Okay, well done, Linda. So let's go straight on to the first question. Uh, First question is, can you elaborate on the role of occupational therapy in pain self-management and how it complements traditional medical treatment?
Yeah, I'll do my best. So I think occupational therapy has always been a little bit of an outlier in the medical model. And just to give you some background and history, I think helps to explain how we're different is, back in like 1910, 1915, around there. Um, it was very biomedical, like it still is now. People, white coats, that kind of thing. We have a gentleman called the father of occupational therapy, William Dunton, who worked in a psychiatric hospital, and he recognized that his patients weren't getting better with just talk therapy or whatever. And so he actually set up a wood shop in the hospital and took patients there and got them engaged in activity and meaningful activity. And guess what? They got a whole lot better. And he started to recognize that engagement in real life and meaningful activities had profound health and wellness benefits, both physically and psychologically. And so the profession also grew out of World War One with a nurse who started doing crafts with injured soldiers, that kind of thing. Very different. They were somewhat ostracized, right? Because it was so not medical and outside scope. So the profession kind of developed from there into a profession that it has been always dedicated to treating the whole person and getting to know each individual person's story, who they are, and all the factors that influence. So we talk a lot about biopsychosocial and spiritual, that we're that kind of beings, but and so that's kind of the training we've had. We have the medical model training, the physical training, neurology, all those pieces, but then we're also trained in psychology, social factors, and then environmental factors, sensory factors, so many different pieces of a person's life. And then everything we do. So when we write a treatment goal, it's required that it has to be connected to that person's meaningful activity outcome. So, which is way different than an exercise or just giving a pill for something, right? It's like we have to really get to know people, work with them in real life, look at how you move, how everything happens. And I would say what sets us apart too is we're not supposed to be anyway. And I will say not everyone's created the same, but we're not supposed to be prescribers of healthcare. We're supposed to be co-creators. We're supposed to work with our clients to co-create a plan that works for them. Some of that takes experimentation, it takes feedback, it's working together. And so we bring our knowledge and experience. But what I used to tell my clients, and I'd say clients instead of patients, because I think we're being hired by somebody for a service. And I want to be responsible for that person. I don't want to put this hierarchy of, you're a patient and I'm a practitioner.
Mm.
It's like you hired me to bring some value into to your life and what goals you want to meet. So you're my client. Like I'm working for you. But what I used to tell people when I would first work with them is, I study the science, the evidence, the research. I have experience. I bring all that. But what we don't know is the science of you. And that's everything about you. And something that people probably haven't had somebody give them permission,
Mm. Mm. Yeah.
right? To figure that out and say, how do I figure out what really works for me and who I am and what's important to me and validate that? Because I think when we talk self-management, that's where the confidence is going to come from down the road, is if you really do understand your body, what works for you, and you've had like a coach to help you discover that.
Yeah.
So
Yeah.
I think that's kind of what
Yeah.
sets
Yeah.
occupational therapy apart.
Yeah. I want to ask Dave, Dave, when you did I know before you hit the pain toolkit, you did a pain management course. Did they have an occupational therapist there?
Don't recall one.
Yeah. I don't know if it's mandatory.
Yeah.
I know in the guidelines, I think they suggest it, but I know a lot of pain management programs here, they seem to miss out on it. But I know,
Yeah, we are talking 12 years ago, and I do have the
yeah,
memory that rivals a goldfish at times, so don't quote me on that.
yeah,
But it was really interesting, Linda, hearing you talking about meaningful. You kept re-emphasizing the word meaningful, and that ties in nicely with the pain toolkit, with the meaningful movement. So, we're not just saying do 10 of these, do 20 of these, do something you enjoy, something that brings you alive, something that you will
yeah,
do when you're not in the mood to do something.
yeah,
So, yeah, thank you for that.
yeah, good
Exactly.
description.
And we have research that supports this, that you get natural opioids in your brain from doing things like that. So they're painkillers there. You get oxytocin, which is a socially connecting hormone that you get. So the value of this, it's hard to measure sometimes, right? These kinds of things. And I think that's why occupational therapy has been pushed aside, because the traditional biomedical research is somewhat easy. Give a pill, do a test, do this, do this exercise and test it. But when you're trying to research a person's experience of life, it gets pretty complicated. But we're getting there, and I'm
Mhm.
seeing more and more value. People have recognized and starting now to do that research to continue to validate that this is what we need to be doing. And what Pete does with the pain toolkit, we need to be doing this. It needs to be integrated and accessible and available to anybody experiencing pain.
Can I
And I
ask,
would say
can I ask you,
acute pain or chronic pain,
yeah,
doesn't matter,
yeah,
pain. It's
can I,
skills for life, right, Pete?
yeah, yeah, yeah. Can I ask you a quick question, Linda? I, al- I know lots of occupational therapists in the pain management world. Bronnie Thompson, as we know, and we recently did a couple of Q&As with a couple of physios over in South Africa, Helen Room and Dershni Devan, and but I struggle uh, when I have spoken to occupational therapists. in general, and I talk to them about, are you doing, self-management stuff? I'm not. I don't want to sort of disappoint you too much, but I don't. The answers are no. There seems to be that it seems to be a bit strange to them. Like, so is there a problem in their respective occupational therapy schools that self-management isn't taught, or have I just been unlucky and met occupational therapists who perhaps I've forgotten or something, or is it not on the curriculum?
I think probably both are true. In particularly in the States, the therapy programs they moved very more towards the biomedical approach
Yeah.
after the time I was more trained. And so we're trying to get it back, but
Yeah.
that is a factor. I think, honestly, Pete, I think the biggest factor is the lack of pain education.
Lack
So
of
we're taught self-management, but what's lacking is the understanding of pain, the neuroscience of pain, all the factors of pain, how to create a pain self-management program. That's why I worked with four doctoral students over 4 years to develop a pain management curriculum here in Colorado for our therapists in Colorado that they could use.
Mm.
And I was president of the state association when I was doing this, so we made it free for members of the state association so that it was accessible so we could get more people trained. And so they got the curriculum, they got marketing materials, they got everything, and they're out there practicing now and using it. Um, just to because you're right, they're not getting it in school, which
No.
is some of them are. There's a few schools that are better than others, but traditionally, but physical therapy is the same. Other professions are
Yeah.
the same.
Yeah.
We're not getting it. So we're trying to advocate, right? And I teach a lot of students. I have been at the universities here and taught many courses, and you just hope that it continues to trickle. It's like dropping a pebble in a big lake, and you're hoping the ripples keep going. But
Yeah. See, personally, I see you guys are. It's nothing against other disciplines, health disciplines like physios or anything like. But I think sometimes occupational therapists are probably maybe best suited to deliver the supported self-management message. Because I'm only going by, um, when I was on my pain management program, I got more. The physiotherapists were great. Everybody on all the healthcare professionals involved were great. But what I was looking for was practical stuff, like, and the occupational therapist, her name was Julie. I can't remember her last name. Julie, I think I'm going to say Julie Darling, not not the same Darling to you. I think it was her last name, and but I really got a lot from that sort of stuff, like, But hey ho, hey, let's move on. Thanks for that. So
yeah,
our second question is, in your experience, what are some of the common misconceptions other healthcare providers have about the scope of occupational therapy in supported pain self-management
yeah, I think we touched on some of that in
already?
what
Yeah,
we were
yeah.
discussing before, for sure. And you know, when I started my practice and was going to lots of education and conferences and that kind of thing, um, I was directly told by a few people that it was because we didn't have enough research.
Uh,
We weren't, you know, weren't respected or whatever. And and I don't think that's it. We have a lot of research. But it's qualitative research, which means it's about people's experience, right? It's more complicated. But honestly, I think it's because what we do is so complicated, Pete. When people ask us what we do, it's like it's like you have a 2,000 piece puzzle in front of you when a person comes to you for
right.
this, right?
Yeah, 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 yeah.
And And so we want to figure out what all these pieces are versus some other professionals, they've already got in their mind what they think the pieces are, right? They've already decided here's what they are and here's how they fit together, and this is what you're going to do in this prescribed way. They think they know the puzzle already and they can figure it out. But if we're practicing with a full scope, and I will say not every therapist is the same, Pete, and we know this. You have to
Yeah,
find the ones who really
yeah,
get it.
yeah,
That's what we're doing. So we're, always like it's a constant interview and a, like feedback and how does this work and how does that, so like I'm looking at your environment and how that affects you, right? How sensory things affect you. Maybe bright lights make your pain go up because that's the way you're wired. How do we figure those things out? What social connections? Like I had a gal and she did this questionnaire and about like her daily life experience. And one of the things that came out of it was that when she was alone, her pain would go way up, which we know can be true, right? Because you're just ruminating or whatever.
yeah,
And she lived by herself. And she decided totally on her own, wasn't my idea. Maybe I should get a roommate. I've got the whole upstairs of my house that I never used. And so she did that, and it helped her tremendously. Just have somebody in the house. I mean,
yeah.
how do you find that kind of thing out if you're not willing
Mm,
and spend the time to really allow people to share their stories, try to dig into a lot of these puzzle pieces that that person can then figure out. That's how you build a self-management.
yeah,
And I, I always wanted people to put me out of a job. I don't want to make you dependent on me to keep coming back and keep coming back so I can do this thing to your body or whatever. It's like, what can you do? And so I think because like I said, we're kind of outliers, we're different, but we're also supposed to be the integrators. So, the other professions can bring their expertise, but like if you do exercises, well, how does that affect your ability to do something you want to do?
mm.
That's where we want to help you translate it into your real life.
I think you're
And
right.
we, right?
I think, yeah. I mean, I like what you say about us being a puzzle, because we have got missing pieces, and that's why I think a lot of us people with pain, persistent pain. I think we are super challenging to the healthcare professionals, because we're not from whatever respective healthcare profession is, we're not one size fits all sort of thing, and we got missing bits of the jigsaw, and it's about not only about our pain. I mean, as we know, after 3 months, the pain really isn't, the main thing. It's all the other stuff we have to deal with, sleep problems, and if we live perhaps we've got a crap job, or we're living in a crap area or something, or we're in a poor relationship or whatever, all that sort of stuff that winds the pain up, but that's never that seems to be sucked off healthcare professionals in general, their radar sort of thing, and I like to think that's I think a phrase you all know, people with persistent pain, whereas we like, as self-management is a simple program for complicated people, and we do get complicated. We do become that. We may have been like a 500-piece jigsaw before pain, but when we get pain, it becomes a 1 or 2,000 piece jigsaw sort of thing, So, okay, thanks. Do you
Yeah.
want to add anything, Dave, before we jump on?
Yeah, picking up on the what triggers the pain, that that really resonated with me because for a long time noise set my pain off. So I
Mm,
had multiple packs of earplugs that I used to carry around in my pocket, and if it got too noisy, I just used to stick them in.
yeah,
And people were like, "What the bleep are you doing?" And it's like, well, I want to stay here for a bit longer. I can't because of the noise. So this is how I cope with it. But yeah, that didn't come out of any course or anything. That was just something that I worked out was a trigger and then tried to work out how I could mitigate it so that I could carry on living.
yeah.
And I think Dave, to your point, is that's the thing. We can figure this out if we're curious, right? About and we feel safe enough in our body to explore those kind of things and not just tough it out and suck it up and
Yeah.
then you pay for it. And that's the problem is I think a lot of us, we've been trained that way, that we're supposed to beat up our body in a way to make it do what we want it to do instead of listening and then making an adjustment. And people, once you get that idea too of self-management, I think, and how critical it is to make those decisions for yourself and not worry about what anyone else thinks or does, right?
Yeah.
But to get to that point can be a challenge when we feel like, well, I don't want to be different. I don't want people to think this, but what happens in our head. And I think that's the critical thing about getting this self-management message across, that it's your power, it's your superpower, really. And you need to exercise it and do it
Hmm.
and take hold of your life and live it and get the best that you can out of your life. You get to stay because you put earplugs in. That's fantastic. And a good OT will take somebody through, if because maybe they've never explored that or given themselves permission, all these sensory pieces, like that, of how your body responds to different environmental things and sensory things. So great message. Good for you. And hopefully somebody who's listening will say, oh yeah, I can do that thing that I'm kind of afraid to do in public.
Yeah.
Yeah, because we're people pleasers as well, because we don't want to disappoint people, and we feel that making an adaptation or enforcing an adaptation for us on somebody else feels like we're not pleasing them. So we have to break that cycle as well. Pete and I have spoken about this at length, and
Yeah,
yeah,
preach it, Dave.
yeah.
Yep, absolutely.
Well, I think we've got time to squeeze in. We've got a couple here, a couple more. Then our super. I like the last one. Won't go into that. I was surprised everyone. Um, what practical strategies do you recommend for self-managers in their daily routines to enhance their self-management performance?
Yeah, hopefully we've touched on some of that, and Dave just did too. I think we have to embrace it too, that we are the experts of our own body. We need to become that for ourselves, do the things that we need to do that we know are the self-care, the being kind to ourselves, not people pleasing, right? It's okay. You don't have to be mean, but you have to, it's your life, right? So become the expert of your body. And that's with health professionals too. So, you want to find and build a care team. That's another piece that does recognize you as the expert, and so that you can give feedback and you can work with that person to problem solve, figure things out if you have questions, and they can work with you. Look for that piece, build that team around you, be self compassionate and care for yourself. I know from my experience with pain too, I think we're, like I said before, we're taught to like beat our bodies up into submission to do what we want them to do. And if you just think about, if there's another human next to you and you treated them that way, how are they going to feel, right?
Yeah.
Like, are they going to be your friend? No, they're not going to be your friend. And so then your body's not your friend, and it can scream at you, and it can use pain to scream at you to get your attention. Like, hey, I really need you to take care of me.
Mm.
And so switching that around, switching that message around in our heads, that sometimes this pain increases or flares or whatever are because our body just says, you're not listening, you're not paying attention, I have needs here, like, be
Mm,
my friend.
mm,
And so I think to build a really good self-management, self-care process for your life is to start there and being kind to yourself. And I think Pete knows this, Dave probably knows this, these are skills for life that are not just for pain. They've
Mhm.
helped me through other illnesses, deaths in the family. I just got diagnosed with hip arthritis, which is pretty young for me, that I might be headed towards a replacement in not too many years, which is like really changing my life. But I'm applying all these all these things to that. And guess what? I'm having a good life and I'm adjusting and I'm getting a handicapped placard for my car because walking this long distances in parking lots hurts.
Yeah.
I don't care what people think, right? I need
Oh,
that. And I'm not going to use it every time, but I need it. So be the expert, do, care for your body and develop these skills for life. That's my
yeah.
best advice.
Not going to the cosmic kitchen really and ordering. I mean, you don't walk into a restaurant and say, give me what you think I'd like." We're pretty definite, aren't we? You know, we we say, "Oh, this is what I want to eat," sort of thing. And it's the same thing with learning self-management, etc. It's about choosing the right things. Sometimes things that you may choose, thinking, well, I don't, that ain't working out. Well, it's okay. Well, then do some, choose something else. I made a couple of videos this morning when I was out doing a walk and whatnot. I was trying to put that over. I don't think I put it over too well in the videos, but about keeping moving and stuff like that. And but it's about choosing a meaningful movement that you will enjoy doing. Funny enough, I was talking to a dude. I bumped into him with his walking his dog, and it's funny. Yeah, I got chatting with her and everything, and he seemed a bit like a troubled soul. He was. I was just chatting away to him and stuff, and so he said, "Oh yeah, I'm retired." I said, "What do you do?" He says, "Well, I don't know." I walk the dog, and I said, "What's your purpose?" And he said, I haven't got one." And this guy was sort of like you see bobbing around in the sea of life, and he told me he just joined our gym, the local one there, and I said, "Do you enjoy going there?" He said, "Well," he went like that, and I think we said, "Well, we'll do something else, and learn something else." But so I could feel some doors shutting on me, So yeah, sometimes but he hasn't let go of things really, So I kept reading it, but I just sowed a few seeds with him, and then sort of give his dog some treats. I better start doing that now because these dogs, when I was going out where I walk locally, like the dogs come up to you and start climbing up, not climbing up my leg for that doing that dodgy stuff, but uh,
There's my treat.
and a woman said to me the other day, "Oh, they're looking for a treat." And I said, "Oh, okay." So I started buying little bags of treats, So I said to the lady, this guy today, "Would your dog like a treat?" He said, "Yeah." So I got him out, and he's one of these big old boy dogs, and he's slobbering all over. But I don't know why I'm telling you that, but anyway. Hey, listen, let's move on to this last warm.
Well, Pete, I just want to say though, this is what's great though about how you live and what you do, because you're an example and a mentor, because you're out there doing your things for life, but you're part of that meaning too is connecting with people, right? And having those conversations and making a difference and planting seeds. And sometimes you don't know.
Yeah,
But that's because you know this and you live this in your heart.
yeah,
And so it comes out in your life and with people. And that's a real gift and it's really amazing.
yeah. I don't know if I'm doing it. I just see it as. It's very nice of you to say that. Anyway, if I wasn't so hot now, you would allow I was blushing,
No, people need to
Pete
I
takes a
mean,
compliment without deflecting. We'll note the date.
this is what you do is just so
Yeah.
it's so great and so connecting, and that's why
Okay.
I always send people to you in the Pain Toolkit.
I don't know. It's funny enough. I always remember I was doing when I first started out years ago. I was doing some work for Essex County Council, when I was the GP, the general practitioner there. She said, "Can you run some workshops for carers?" And I did. So that was all dotted around the Essex County sort of thing. Anyway, she said, "Oh, I better come out and see what you're doing," So I went out there, and she come over and she sat there. She come up to me at the end. She said, "You don't know what you do you?" And I said, "I don't know. What do you mean?" She said, These people are the bane of my life." She said, "They run me ragged, but there you are. You had a meeting at the palm of your hand." There's something, you've got something special here. And I said, oh, well, I don't know what it is. Perhaps if I find out one day, I'll bottle it and uh, try and flog it. But it's just, I don't know. I'm just being Pete. I'm no special dude. I'm just a dude. Anyway, um, last go on to the second to last question. So, how can self managers advocate for themselves when working with healthcare professionals like yourself to ensure they receive the comprehensive healthcare? I like this one.
Yeah. Um, I think my experience with this comes mostly from my personal experience with being in pain and having a lot of medical trauma, actually, and, being not listened to and not validated and told, done things to me. And so it's been a challenge, I think, for all of us in a system that is kind of set up sometimes for I'm the expert and you're the patient. And how do we how do we get our voice heard, right? And it can be really discouraging at times. I just had a new experience with a new practitioner about my hip, and I was hopeful based on what I read online. And I was still, I'm a health professional. I was still dismissed and talked down to. And it's like, wow, come on, people, but it doesn't upset me as much as it used to now. I kind of expect it in a way, but I still stand my ground. And then I find people. I keep looking. I'm going to keep looking. I'm going to find those people because I know they are out there. They're rare, but keep finding those people. Do the best you can. If you're stuck with some health practitioners that you don't feel listening, just try to keep speaking up. Don't lose your voice. That's the biggest thing. Don't lose your voice. And also don't look to be validated. I think I wanted that validation that it gets hurtful when you don't get it. Um, Validate yourself. If you really feel strong, you get strong in this message of you are the expert
Yeah.
of your body and they work for you. You're hiring them, you're the client, right? If you can keep that perspective, I think it gives us strength to speak up and ask for what we really need.
A few years ago, I started using the phrase to keep yourself in a driving seat,
Yep.
because I think the what a medical model does, it takes you out of the driving seat and puts you in a passenger seat, and then you're being driven around the health system, sort of thing. It's not a, but it's a. I think both healthcare professionals and patients, we need to work more together in partnership. Especially with living with a long-term condition, and it's that I see goes back to. I'm not beating up on anything. They can't, if you're when they're in their respective medical schools, if they've only been taught a certain way, then that's what they can't teach. They can't what they don't know. I'm not encouraged to do, sort of thing. And but I also people like myself, get yourself back in the driving seat. I remember years ago when I got diagnosed with a prostate cancer, back in 2016. I was all over the shop, I was lucky enough that good buddy of mine, Professor Sam, he I was talking to him one night on Skype, and I said to him, "Oh, they're bloody doing this, da 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 da." And he pulled me up straight away. He said, "Well," he said, how do you manage your pain?" I said, you know how I manage it. I'm really proactive." He said, "Why are you being so passive?" Oh, yeah. So what I did the next day is I got hold of the dude, cancer people, and no, didn't have a row with them or nothing like that about arguing with them, but I put myself back in the driving seat, and I've been there ever since, So it's not so. I don't think they wanted to get me into doing quite some aggressive treatments for the cancer, but I know talking to Sam and talking to other people with pain and cancer, some of the treatments they have, they're going to remission and whatnot, but they're left with so much damage to their bits and bobs, their organs, that It's outweigh it's sort of it's more sure they're in remission, but they've got painful joints or something, through the harsh treatment. Anyway, another story.
Yeah, you have to make those decisions. I
Yeah,
think,
yeah,
go yeah, Pete, I've heard your illustrations that you've done for, and I just love them because the driver's seat one, I think we're not taught that way in school, any health professional.
yeah,
You're taught to be an expert, and you feel like your identity's tied up in that, and that you got to know everything. And you kind of have to unlearn that when you get out
yeah,
in practice if you're
yeah,
really going to be a compassionate, caring practitioner, because they just train you science. This is what you do. Here's evidence, blah, blah, blah. And you have very little experience with just working with an individual person until you get out in practice.
yeah.
But that's why, people like you and what you're doing and the message you're getting out, and you're training health professionals and getting people to recognize and think differently is it, it's what we need more of, and we need more from our clients than we do from health professionals. We need to listen more from those of you who are living this and living it well. That's great evidence. That's the stories we need, is the lived
Well,
experience.
I keep telling them though, Linda. I keep saying, look, you got two of these and one of these. The fact you got two ears sort of gives it away. Learn to listen and listen to learn.
Exactly.
They could learn
Uh,
so much from us. Dave, before we go into the last question, do you want to add anything?
Yeah,
I
if you
mean,
want to learn more about this stuff, we've got the European Pain Management Conference, Self-Management Conference, was it the 8th of October, something like that?
18.
18th, sorry.
Yeah.
I'm only speaking at it. I don't need to know what date it is. But there's three people like myself or two others like myself that are self-managers and living with pain, and then there's three healthcare professionals, and it's a great way to learn more about it. And if you go on the Pain Toolkit website, there are links to the previous conferences if you want to. So yeah, this will help. This will hopefully help drive that conversation between healthcare professionals and patients. And to a certain extent, we're preaching to the choir or to the converted, but there's always the hope that somebody will be interested and will come along and we'll get one more person, and that will help to get the message out that little bit more.
yeah.
Yeah. See that's what we try to do when myself and Keeper started up when we started doing the worldwide ones 4 years ago. We made sure that we had that balance of healthcare professionals and self-managers. In a way, we're trying to role model to the other pain organisations about including patients, within their conferences, and so there's we're promoting teamwork, because we can't get the best out of things unless we're working together. So, and I think that's what I come away with the where we met at the IAPS Congress in Boston in 2018, I think it was. And because they actually invited a load of patients were actually doing workshops there, I mean
Nice.
that was Captain Kirk stuff, So
Totally was.
yeah, they haven't. I don't think they've. I was at the one in Amsterdam last year, but I think the patients were invited, but there's nothing on that level there that we had in 2018. But hey, oh,
I took that message to heart after that ISP conference, and so I have been involved in organizing the Colorado Occupational Therapy Association annual conference. And so at what we have now is like it's a 3-day conference, and so at the end we have someone with a lived experience is a keynote to send us
Nice.
off. So
Oh,
I felt like we need that message. Like we can learn stuff during the conference. We need the person with a lived experience at the end to kind of send us back into the world with their experience. So guess who's our keynote this year, Pete?
oh, ain't Keith, is it?
Joletta.
Joe Ledder. Oh,
oh,
well done,
Yeah,
Joe Belton.
she
Yeah.
lives she lives here, so I'm
Oh,
super
yeah. Well,
excited.
yeah, makes sense. Yeah.
yeah,
Yeah.
nice.
So
Yeah.
So Joletta Belton's going to be our final keynote at the conference in
Right.
September. So
By the way,
yeah.
we like, well, I don't know myself, I like using the term living experience because
Mhm.
I'm not dead yet.
There you go. All right, I got a new one. I got a new one.
Yeah.
I'm gonna
So
switch to that.
Liv sort of says, well, something's gone, it's finished, like, you know,
Mhm.
but I'm still having a living experience with pain.
Thank you for that, Pete. I love it. I love it.
Well, coming on to the last question, I don't know, this half hour or so, it's been, I've gone over our time, but who cares?
Yeah.
And I've really thoroughly enjoyed it. But we're going to come on to the last question for you, Linda. So imagine you are a host of a dinner party with three prominent figures in healthcare. Who would you invite, and what would you discuss regarding self-management?
I love this question, Pete. I love this question because I would invite you, Joletta, Keith Meldrum, and now I can add Dave. Can I add Dave to it too?
You can, yeah, you can invite who you want.
Oh,
Because you're
thank
my
you.
people. You guys are my people. I mean, I always learn so much, and I always have every client I ever had. I always said I'm learning from the people I work with
Yeah,
all the time, and so that's who I'd want to invite to dinner. We would have fantastic conversations,
well,
and it would be really meaningful for me talking about engaging in meaningful activities, right, for yourself. It would just be so fun and so rewarding and meaningful for me personally. um, I would just love that. So if we could ever make that happen, that would be fantastic.
I do the lottery every week. But I'd love to meet up. See, I mean, again, see from that conference, you know, like Joe and we, like Keith, I call him my brother, and Joe is my sister, and I think I'll have to start calling Davey a brother as well, like, you know, because we're
I'm so young, you can call me son. It's fine, you know.
oh, son. I might be old enough to be your dad,
You
actually.
got a
Yeah.
you got a whole
Yeah, you are.
family now.
Perhaps perhaps if we can't do it physically, perhaps we can do something like this on with us four, you know, us five, I should say, like, you know. But I'd love to. So, I mean, I know you got. I won't go into the political sort of side of it. I'm not sure if I'd be let into your country at the moment because of because of you know who. But I don't want to go
I'll
down
come
that.
visit you.
Yeah, yeah. Why not? We'll fly you over here, and yeah, because I think they look at your phones or something now, and
I,
yeah, I wouldn't be allowed in
I'm
anyway.
not getting into that.
No, no, mate.
no,
Oh, I'll
no,
tell you
no.
where we
We
go.
have to stay in our happy place.
Let's go to Canada. Let's meet up
Now
in
that's
Canada.
a good call.
Yeah, that's a good call. Let's
Yeah.
meet in
Oh, we
Canada.
can
Yeah. Anyway, guys, listen,
we
thanks
can
very
do
much
that.
for joining us on this Paint Toolkit Academy Q&A. I've really thoroughly enjoyed it, and I've learned a lot more. Learned a lot from Linda again. She reminded me about lots of things. Occupational therapy to me is, I think, missing missing link in a lot of healthcare, etc. And there's a lot of good OTs out there who have got a vast knowledge about on supported self-management, not just for pain but for long-term conditions as well. Hence why we've had a lot of OTs presenting, like with Helen Room down here in and Dershni from South Africa. They did fantastic presentations as well. So again, Linda, thanks very much for giving up your time on a Sunday morning over there in Denver. It's just coming up to 6:30 here in the UK on a Sunday evening, super sizzling evening. And but anyway, we'll see everybody again. Well, we're back again tomorrow night on Monday night with Dr. Asim, a GP from the north of England, and we'll do another Q&A with him. So take care, Linda. Look after yourself. Thanks very much. See you, Dave. See you
Will
tomorrow.
do. Keep
Yeah,
going.
we
Doing
will.
awesome.
We
Thank
will.
you for the work.
Yeah, take care. Be cool and groovy, baby.
Got it.